Let me tell you about Jason. He's 38, an aircraft mechanic, married 11 years, and for 6 months, his body kept betraying him at the exact moment it mattered most. It started with one off night, then another. Soon, every time intimacy got close, his mind would sprint ahead. What if it happens again? He tried cutting porn, tried breathing tricks, tried Kegels from a Reddit thread, even tried a miracle supplement stack that made his heart race. Nothing worked, not for months. Then he tried Tadalafil and still failed. And that's when he told me, "Doc, I'm taking the pill. So why do I still feel broken?" But then I asked him one question that changed everything, because the problem wasn't the pill, it was how he was using it. I'm Dr. Mary Edwards, a sexual health educator focused on erectile performance, confidence, and the real-world habits that make results predictable. Over the last decade, I've worked with thousands of men dealing with ED, performance anxiety, and relationship pressure. And what I'm about to show you contradicts what most guys assume. That Tadalafil creates an erection. It doesn't. It amplifies what your body is already doing when you set the conditions correctly. By the end of this video, you'll know when Tadalafil works best, timing that most men mess up, which dosing style fits your situation, and why more isn't better. The 4-step protocol that makes erections feel automatic again, and most importantly, how to get reliable, extraordinary erections without living in fear. And at the 10-minute mark, I'm going to give you a 60-second test that tells you whether your issue is mostly performance anxiety or a deeper health signal you should not ignore. Now, back to Jason. Before this started, Jason was the steady guy. Show up, fix the problem, keep moving. Then work got brutal. Overtime, deadlines, sleep cut in half. One night, he couldn't perform. His wife was kind, but he saw the split-second pause in her face, and his brain grabbed it like a weapon. He told me, "I started watching myself like a hawk. Every sensation felt like a test." He'd wake up at 3 a.m., chest tight, replaying the night like a crime scene. Doctors told him the standard advice: try a PDE5 inhibitor, reduce stress, exercise, you're fine. So he got Tadalafil and used it the way most men do, right before sex, sometimes with a couple drinks to loosen up, sometimes after a heavy dinner, and he expected a switch to flip. But here's what happened. He'd take it, wait, start intimacy. Then the moment pressure hit, his nervous system slammed the brakes. He said, "I felt my body go cold, like it was pulling the plug." By month 6, he wasn't just avoiding sex. He was avoiding eye contact, avoiding touch, avoiding initiating. Because initiating meant risking failure. Then he came to me and said the line I hear from so many men, "I'm scared she'll think I'm not attracted to her." So I asked him the question that changed everything. "When you take Tadalafil, what do you think it's supposed to do?" He blinked and said, "Give me an erection." And that's the misunderstanding, because Tadalafil isn't a starter motor, it's a power amplifier. And if you amplify the wrong signal, stress, pressure, adrenaline, guess what gets louder? Now let me show you what was really going on inside his body. Here's what most doctors miss about ED, especially in men with performance anxiety. They focus on the penis, but the real issue is often happening in your nervous system and your blood vessel signaling. Layer 1, surface level. When you lose firmness, most people think low testosterone, or not enough desire, or I need a stronger dose. Sometimes those matter, but often, especially in men like Jason, the root cause is fight or flight. Layer 2, deeper level. Your erection system runs on a relaxation signal. When you're turned on and calm, your body releases nitric oxide, blood vessels relax, and blood flow increases. Tadalafil supports that pathway by helping preserve the signal so blood vessels stay relaxed longer. Think of it like this. Your body sends a green light to open the highway. Tadalafil helps keep that highway open. But if your brain sends a red light, stress, fear, pressure, the highway closes anyway. Layer 3, root cause. The real problem for many men is not lack of medication. It's too much adrenaline at the wrong moment and using Tadalafil in a way that doesn't match how it actually works. This is where it gets interesting. Tadalafil has a long half-life, about 17.5 hours, which is why it can work across a long window, not just a short burst. And guidelines describe effectiveness starting as early as 30 minutes, peaking around 2 hours, and lasting up to about 36 hours in many men. So if you take it like it's a last-second rescue, you're often using it at the worst possible time, right when anxiety is spiking. And here's the proof from clinical data. In one study, successful intercourse attempts, a standard trial metric, were around 64%, 70% with Tadalafil versus about 33% with placebo. That's a huge difference when it's used correctly. Now, I want you to remember this because you'll need it for the test I promise later. Tadalafil doesn't create arousal. It protects blood flow after arousal begins, which brings us to the protocol. Step 1, the safety gate, the hard no list. Before you optimize anything, you need one reality check, because this is health, not a party trick. What to do? Run a quick hard no scan. Nitrates for chest pain, angina. 1, do not combine. Recreational poppers, amyl nitrite, or do not combine. Be cautious with certain alpha blockers and blood pressure meds. Why it works? Because Tadalafil and nitrates together can drop blood pressure dangerously. How to do it? If you use nitrates, this video ends here for you. That combination is a hard stop. And if you're unsure what your meds are, check the label or ask your prescriber. What you should notice: peace of mind. You're not gambling with your heart. Common mistake: guys skipping this step because they're embarrassed. Don't. This is basic health hygiene. Micro story B-roll. Older man holding nitroglycerin spray, then shaking head no. One of my patients, Ray, 63, thought Tadalafil didn't work. Turns out he was also getting chest tightness on stairs and had nitrates at home. That wasn't an erection issue, that was a heart warning, and handling the health side came first. Step 2, pick the right strategy, on demand versus daily. What to do? Choose the dosing style that matches your life, not your panic. There are 2 common clinician-directed strategies: on demand for planned intimacy, daily low dose for spontaneity and confidence. Guidelines describe Tadalafil as used on demand, commonly 10 or 20 mg, or daily, commonly 5 mg, adjusted based on response and side effects. Why it works? Because the wrong style creates pressure. Pressure creates adrenaline. Adrenaline kills erections. How to do it? Ask yourself, do you want a window for the weekend? On demand may fit. Do you want confidence without scheduling sex? Daily may fit. What you should notice: less performance, countdown, more natural initiation. Common mistake: switching styles every week like you're gambling. Pick one approach and give it a real trial period. Visual cue: calendar flips, then relaxed couple cooking at home. Step 3, timing. Style everything. The 2-hour rule. Now, this next part is crucial. What to do? Stop taking Tadalafil like an emergency button. Start using it like a setup. Why it works? Peak levels are often around 2 hours after dosing, and effectiveness can extend across a long window. How to do it? Practical. If you're using on demand, give yourself a runway. Think about 2 hours, not 20 minutes. Don't turn it into a stopwatch. Turn it into a window. What you should feel, notice. Your body feels more ready with less forcing. You're not trying to ignite a cold engine. Common mistake. Taking it and then immediately testing yourself in your head. Is it working? Is it working? That mental checking is basically pouring ice water on arousal. This is exactly what Jason did wrong at first. He took it right before sex, then stared at the moment like a scoreboard. When we shifted him to the window mindset, everything changed. Step 4. Activate the signal, because the pill is an amplifier. Hold on, because this is the part that makes Tadalafil feel weak or amazing. What to do? Create arousal on purpose and lower pressure on purpose. Why it works? No signal, nothing to amplify. How to do it? Here's the 3 locks checklist I gave Jason. Lock number 1, stimulation. Start slower, more foreplay, less rushing. Stop treating sex like a performance and start treating it like escalation. Lock number 2, nervous system downshift, 90 seconds. Inhale 4 seconds, exhale 6 seconds. Repeat 6 times. Shoulders down, jaw unclenched. This tells your body, we're safe. Lock number 3, environment reduce alcohol, especially heavy drinking. Avoid turning intimacy into a pass-fail test night. What you should notice: more warmth, more sensitivity, more automatic firmness. Common mistake: trying to brute force it with intensity. Intensity plus anxiety feels like pressure. Pressure triggers fight or flight. Jason told me, when I stopped trying to win, my body finally showed up. Retention bomb. Step 4.5, the do not stack randomly rule. If you're still watching, you're in the top 10%. Here's your reward. Most guys don't fail Tadalafil because the drug is bad. They fail because they stack random things: more dose, more alcohol, more pressure, more porn expectations, then wonder why the body shuts down. Extraordinary erections come from repeatable conditions. That's real health, not hacks. Here's the 60-second test. Answer these 3 questions honestly. Do you still get morning erections at least a few times a week? Can you climb 2 flights of stairs without chest pain or unusual breathlessness? Has your waistline and overall health been trending better or worse in the last 2 years? If you're mostly yes, and your problem shows up mainly under pressure with a partner, your biggest lever is often anxiety plus conditions, not stronger meds. If you're mostly no, don't just chase erections, chase the health signal underneath: blood pressure, sleep apnea, diabetes risk, cardiovascular fitness. Why? Because ED can show up 2 to 5 years before major cardiac events in some men, and meta-analyses show higher cardiovascular risk in men with ED. That's not meant to scare you. That's meant to give you power. So what happened with Jason? Week 1, he stopped testing himself and started using the window. His anxiety dropped because he wasn't forcing a moment. Week 3, he had his first no-pressure success night. Not perfect, but solid. And the biggest change? He said, I didn't feel like I was auditioning. Week 6, he reported consistent firmness and, more importantly, consistent confidence. His wife said, you feel present again. That was the real win. Now, will it work exactly the same for you? It depends. If your ED is mostly performance anxiety, you'll often see faster results when you fix timing plus pressure. If it's more vascular or metabolic health, you may need lifestyle changes plus medical support. Pattern interrupt. Jason had one setback in week 3. Here's what he did wrong. He drank more than usual at dinner and treated the night like a must-succeed mission. How did he fix it in 48 hours? He went back to the protocol: window, downshift, no scoreboard. Let me break down the key takeaways. Old approach. Take Tadalafil at the last second. Expect it to create an erection. Add pressure, alcohol, and mental checking. Assume higher dose, better results. New approach. Use the window, not the emergency button. Remember, It amplifies arousal. It doesn't replace it. Reduce adrenaline and create safety. Treat ED like a health signal, not a shame secret. Remember this phrase, no signal, no strength. The pill is an amplifier. Now some of you are thinking, what if I try this and still fail? Here's the thing. One bad night doesn't mean you're broken. It means you need a cleaner protocol and sometimes a deeper health check. The men who see results start this week calmly and consistently. The men who don't, they wait until panic forces them. Which one will you be? If you want the full protocol written out step by step, I made a free guide called the Tadalafil Protocol Checklist. Link is in the description, so you can follow it without overthinking in the moment. I also linked a related video on performance anxiety, because if your mind is the trigger, you need the mental tools too. If this video helped you understand what's really happening and how to fix it, hit subscribe. I post simple, practical health protocols that make real life easier. And comment below with this window if you're switching from panic timing to protocol timing, and tell me, what's your biggest struggle right now? Timing, anxiety, or consistency? I read every comment. I'm Dr. Mary Edwards, and I'll see you in the next one.